I actually sat in the chair where the reading Who's an Addict was sitting, and I read that, and I realized for the first time in my life that I was not alone.
Mm.
That there was other people that struggle with the same thoughts and feelings that I felt my entire life were going to kill me if I didn't get high.
Mm.
And I didn't stay in recovery. I in and out and in and out and in and out. But that was that moment of hope, that first meeting ever. And there was many moments of hope to follow, but like that was my initial moment of hope, I would say, trying to get clean. Johnny?
Yeah, talking to, a newcomer is the main reason that we're still here. Uh it's but it's a delicate balance, when talking to a newcomer, you have to really first you have to read the room. You kind of got to ask them what their drug of choice was and know who you're dealing with, talking to an ex-heroin addict versus talking to an alcoholic, it's two different things. I've never done heroin. I don't know what being dope sick is like, and if somebody's talking to me about it, I can relate, but I don't have the exact experience. So you got to first recognize your audience, and then they need to realize that we're kind of all in the same boat. Addiction is addiction is addiction, and it's it's work, and it's gonna be hard, and it's gonna take time. But give yourself a chance. Give yourself a chance is I think the biggest message. We're all here for the same reason. Some of us have 10 years sober, 20 years sober, 3 days sober. We're all here for the same reason. We don't want to use again. And they have to have that feeling that somebody gets them.